This is a remarkable study in regard to a relatively small amount of this particular extract of a Latin name called Ageratum, Conyzoides. You're going to see me replace that term often with Billygoat weed, which is a lot easier to say and far more easier to comprehend. So I'll be replacing that word off and on as we read through. But Billygoat weed in this 12-week randomized double-blind placebo-controlled trial had quite a remarkable result at a mere 250 milligram of this extract taken with evening meals. So let's look into the study a little bit more detailed. Here we are. You see the trial type, the duration, the dosaging, and the extract composition we'll review in a little bit as well. But that's quite a remarkable outcome in regard to the study. Now it gets really good. Check this out. 56% lower pain scores as regard to generally the baseline. Looking at the baseline, not the placebo, where it's about versus 39% for the placebo. But that's quite an effect. Another thing to take away, too, on top of this, is to postulate. It may actually have a cumulative effect. Remember, we're only talking about a 12-week period of time. And we'll get into the reason why we may postulate that, or the researchers, as we proceed. All right, so we'll look at this. Here we go. Not just the better quality of life. All right, we're looking at that. We're looking at about 26.5% better quality of life over the baseline with the mere 12 weeks. But where it gets real interesting is where the placebo had absolutely no comparative effect, the systemic inflammation. The inflammation reduction was quite astounding. Now, as you begin to continue down that line of a 12-week period at 250 milligrams per day of this extract being taken with evening meals, you see where this cumulative effect in regard to the hypothesis in reference to that may have some strong credence. All right, to proceed forward, it only gets better. All right, look at the WOMAC score as far as the 37.6% reduction in symptom improvement and the pain and function as well, quite significant over time. Without reiterating too much, we're just talking 250 milligrams of Ageratum Conyzoides. Otherwise, as we've commonly referred to as Billygoat weed. A few other names too. We'll get into that in a second. And there we are. Billygoat weed, goat weed, tropic Ageratum, and white weed on top of that. And there's your key bioactive compounds for the references. For the researchers and healthcare professionals, we're about to get into that in a second, but let's delve into the study itself. The effect of Ageratum Conyzoides on osteoarthritis in an aging adult population, a double-blind, randomized, placebo-controlled, parallel study. I'm going to read it kind of fast, just to give you a little bit of the backstory. Then we're going to get into the conclusion and look at what's for the researchers, power ratings, so on and so forth, and healthcare professionals as well. To proceed as follows. Ageratum Conyzoides, commonly known as Billygoat weed, is an annual herb native to Africa, Asia, and South America. When you see the really profound effects it has on so many different ailments, you wonder why it's not more commonly known. Maybe it's time in our part of the world it's beginning to rise in precedent. To proceed, Ageratum has a long tradition in the use of ethnomedicine for a wide range of conditions, including fever, rheumatism, headaches, toothaches, skin disorders, leprosy, inflammation, pain, spasm-related ailments, and as a topical dressing for wounds. Febrifuge, purgative, anti-inflammatory agent. Febrifuge is basically temperature reducer and wound healer. This therapeutic versatility is attributed to its diverse pharmacological activities, including antioxidant, antimicrobial, analgesic, and anti-inflammatory properties. Skipping a little bit ahead, given Billygoat weed's well-documented analgesic and anti-inflammatory properties, particularly those derived from the polymethoxyflavone extracts, and its demonstrated safety during prolonged therapeutic use, it represents a promising alternative for osteoarthritis management. Although preclinical studies have consistently demonstrated the analgesic and anti-inflammatory effects of Billygoat weed, to date, no published double-blind placebo-controlled clinical trials have evaluated its efficacy in osteoarthritis management, of course, until now. The present study therefore represents the first such clinical trial addressing the important gap in the literature. The study aimed to evaluate the effectiveness of Billygoat weed, white weed, tropic energetic compared with placebo in alleviating osteoarthritis symptoms in aging adults, hypothesizing that Billygoat weed supplementation would significantly reduce pain severity and improve joint function compared to placebo. That's our backstory. Now I'm going to skip ahead to the conclusion and want to give a little more detailed and a few more charts there to give some more meat to the story. The daily supplementation with a mere, that's publisher bias, me interjecting, 250 milligrams of Ageratum Conyzoides extract over 12 weeks was associated with significant improvements in pain, physical function, and quality of life in individuals with osteoarthritis, accompanied by a reduction in key inflammatory cytokines. We saw in the first part of the chart was quite amazing, where the placebo basically didn't have any impact. Consistent improvements across patient-reported outcomes, functional measures, and biomarker assessments underscores the therapeutic potential of Ageratum Conyzoides, Billygoat weed, in osteoarthritis management. Importantly, a favorable safety profile and reduced reliance on rescue medications, we're going to get to in a second, meaning reduce the need for certain medicines, further strengthens its suitability for long-term management of osteoarthritis. Here we go. Do you see right there? 6. We lead the reduced need for rescue medication, which was beautiful. The overall conclusion, improvements in pain, physical function, quality of life, and inflammatory cytokines. And it was found to be safe and well tolerated at that 250 milligram extract of Ageratum Conyzoides Billygoat weed per day. All right, now for the healthcare professionals. This is the breakdown. We want to get a little more detailed as far as how they did, what they did, and into the study itself. There it is. You could pause if need be. Now for the researcher, or I should say the data scientist, which I started including the power rating to give a little more depth to the story itself. And there we have it. Study protocol, the design, the endpoints to be measured, as well as the power rating. Now, you notice the B minus there on the sample size because basically the researchers admitted the limitation. They like to see a larger sample, but incredible quality study overall. Pretty amazing. So there you have it. In ethnomedicine, Billygoat weed appears to be quite a spectacular tool in regard to nutraceutical, how to describe it, I don't want to say medicine per se, for additions in helping alleviate some of these challenges, especially in regard to osteoarthritis. It's just now coming into light how incredibly valuable something that may be seen as a weed, basically, may be for the general health of our human populations. Again, quite incredible. Gratitude to the researchers for looking into this. Beautifully well done, constructed study. I am humbled you watch and look forward to seeing what you and I discover next week. Again, Billygoat weed, Ageratum Conyzoides. It has such an incredible, spectacular profile. It is just now beginning to hit our world, and hopefully it will grow in precedent as time proceeds forward. Gratitude. Thank you. I look forward to see what we all discover next week. Catch you next time. Bye.